Halo Sobat Espos, berjumpa kembali dalam Espos Live, kali ini bersama dengan Parkway Cancer Centre Singapura. Dan di kesempatan kali ini Sobat Solopos kita akan ngobrol terkait dengan kanker payudara dan TCM. Apa itu TCM dan seperti apa kanker payudara? Dan tidak sendirian karena hari ini kami akan ngobrol bersama dengan salah seorang ahli kanker dari Parkway Cancer Centre Singapura, dari klinik perawatan kanker holistik di seluruh jaringan rumah sakit Parkway Hospital. Ya, ada Dr. Fu Kian Fong, dan tidak lupa kami juga akan ngobrol bersama dengan keluarga dari penyintas kanker payudara Ferdinand Kusumo. Jangan lupa, ada juga sesi tanya jawab dari para netizen. Oke, langsung saja kita akan ngobrol bersama dengan Dr. Fu. Lebih lanjut, kenapa sih hari ini kita akan membicarakan seputar kanker payudara atau breast cancer? Karena kita tahu sendiri bahwa menurut data, yang namanya kanker payudara ini menempati urutan yang paling tinggi untuk penyebab kematian di Indonesia sendiri. Sementara sebenarnya kanker payudara sendiri ini bisa diminimalkan untuk risikonya dan bisa disembuhkan jika ditemukan masih dalam kondisi dini. Nah, seperti apa nanti? Karena ada juga pengobatan kanker payudara yang tersedia saat ini dengan metode-metode yang berbeda. Nah, apa saja nanti metodenya? Karena selain pengobatan medis, ada juga bentuk pengobatan alternatif untuk kanker payudara. Sebenarnya bisa nggak sih dengan herbal? Nah, secara langsung nanti kami akan ngobrol bersama Dr. Fu Kian Fong, pakar dari Parkway Center Kanker Singapura, yang akan berbicara terkait dengan kanker payudara dan juga apa itu TCM. Nah, ini yang baru dan sepertinya memang ini sedang sangat banyak dibicarakan, TCM. Dan tentunya untuk Sobat Espos yang ingin bergabung bisa bergabung melalui YouTube kami, dan juga untuk yang ingin bergabung melalui channel YouTube kami bisa menyampaikan pertanyaan-pertanyaan juga. Oke, baik, langsung saja saya akan berbincang ataupun menyapa Dr. Fu. Halo, selamat.
Halo, good afternoon.
Sore, Dr. Fu. Apa kabar?
I'm fine, thank you.
Oke. Hari ini kita akan ngobrol soal kanker, dokter.
Yes.
Oke. Bisa dijelaskan dulu nih, dokter. Apa sih sebenarnya penyakit kanker ini bisa muncul, dan apakah kanker payudara ini munculnya awalnya seperti apa dan faktor risikonya seperti apa?
Okay, I will share my slides now. Can you see the slides?
Yes.
I will go ahead. I will be talking about breast cancer. What is breast cancer? Breast cancer is a malignant tumor which occurs when the cells in the breast grow out of control. Okay, so this is statistics from Indonesia, and among the women, the top cancer among Indonesian women is breast cancer. Okay, just to let you all know a little bit about the anatomy of the female breast. As you can see, it has the nipple, this is the breast, and it all goes to what we call lymph nodes. And if you do an operation, you will see that the breast consists of fat tissue with little lobules and ducts, which leads to the nipple. The lobes are the place where milk is produced, and the ducts is where the milk will be expressed into the nipple. Okay, cancer can occur in any part of the breast, from the skin to the ducts, to the lobules, to the fat, to the muscles. What is it and where does it start? About 90% of the cancer start in the ducts and the lobules. So if it occurs in the lobules, it's called a lobular cancer. If it's in the ducts, it's an intraductal cancer. Among all the cancers, the most common is the ductal cancer in the breast. Okay, what are the risk factors for breast cancer? We divide them into factors that we cannot change, like your sex, female, as you grow older, and some genetic factors like BRCA, or you have a family history of breast or ovarian cancer, and your periods, for example, you have an early period and late menopause, your risk is also higher. And of course, if you have a history of abnormal breast biopsy before, your risk is also higher. Okay, then we have factors that we can control, or so-called lifestyle-related factors. This include alcohol. Studies have shown that each daily drink increase the breast cancer risk by about 12%. The next one is not having or having children very late. People who have the menopause and they go on hormone replacement therapy, they also have a risk for breast cancer. And those who were taking oral contraceptive to prevent pregnancy also has a risk. And of course, smoking also has a risk that contribute to breast cancer. There are some things that we find that can be productive and also may help to prevent breast cancer. Number one is physical activity. That means if you are active all the time, you do exercise all the time, you have a reduction of about 30%. People who become pregnant also can have a protective effect. It also reduces the risk by 30%. And those who breastfeed also is also useful. Again, the reduction is about 30%. And of course, we also want you to have ideal body mass. That means not too fat or not too thin. The main problem is those who are too fat. Those who are too fat, well, actually the risk is higher. Now that you have learned about the risk factors and the protective factors, we want to look at what are the signs. How do you know that you have breast cancer? All right, what are the signs? Okay, some of the signs of breast cancer includes any swelling in all or part of the breast, any skin irritation or dimpling of the skin, especially around the nipple, breast pain, nipple pain or the nipple turning inward, redness, scaliness or thickening of the nipple or the breast skin, a nipple discharge other than breast milk, like bloody discharge, all right? Or you feel a lump in the underarm area. Okay, so this is a little cartoon about all what we have just said. For example, the first one is about a lump that you can feel that's persistent, or you may have changes in the color or skin of the breast, especially around the nipple, all right, with dimpling or puckering or scaling. Or you find a newly retracted or inverted nipple. The nipple doesn't evert out. Or do you have a blood discharge? And of course, change in the size and shape of the breast. If you have any, you please see a doctor. Are there different types of intraductal breast cancer? Yes. Okay, so the main types of intraductal breast cancer will include what we call hormone-sensitive breast cancer. And this contributes to about 70%. And these people, your doctor will tell you you are an estrogen receptor or progesterone receptor positive. Estrogen receptor is ER, progesterone receptor is PR. And these people, the cancer is driven by hormones, all right? Then there's a second group called the HER2 positive breast cancer, which accounts for about 15%. And the last is what we call triple negative breast cancer, again, accounting for about 15 to 20%. So majority of our breast cancer patients is in the hormone-sensitive breast cancer. Okay, so I'll just talk very briefly on how is breast cancer treated. Okay, so the treatment depends on the stage of the cancer. There are more than one treatment used. Usually we use a combination. It will include surgery, radiotherapy, chemotherapy, hormone therapy, and sometimes targeted therapy. Okay, so just briefly on surgery. So for example, this is the breast, this is the tumor. Total mastectomy is to remove the whole breast, and what is left is just a scar on the chest wall. Then there's another form of surgery we call lumpectomy, where we remove just part of the breast with the tumor inside, and also to biopsy the axilla, the armpit area for the lymph nodes, and you end up with a slightly smaller breast with the surgical scars there. Okay, so is surgery alone able to cure breast cancer? Okay, so this is just a short summary. We find that if your stage is early, there's a good chance that surgery will cure. But we do know even at stage 1, there's a 5 to 20% risk of recurrence in 10 years. As you get more advanced up to stage 3B, the risk of recurrence is very high, up to 70 to 90%. So what determines the risk of recurrence and the type of treatment after surgery will depend on your tumors, the size of the tumor, the grade of the tumor, whether they are hormone sensitive, ER or PR positive, or a HER2 positive, also the number of lymph nodes that are positive, and also the age of the patient. So besides surgery, other treatment that is used to help to cure the patients include chemotherapy, hormonal therapy, targeted therapy called Herceptin. This is for those with HER2 positive breast cancer. More and more recently, most doctors are also doing what we call neoadjuvant or primary therapy. That means you have a big tumor, which is very difficult to operate. We give them chemo, hormones, as well as targeted therapy to shrink the tumor so that they can go for a much easier operation. And the benefits will include downstaging so that the surgery is much easier. And also it gives us a knowledge of the treatment efficacy. So what I've just spoken to about surgery and adjuvant and neoadjuvant therapy is applicable for stadium 1 to 3 breast cancer. Very often we have patients with stage 4 breast cancer, and these patients will usually need either targeted chemotherapy or hormone therapy or a combination. So this is for stage 4 breast cancer. As you can see, surgery, chemotherapy and all is quite painful. So what we want to do is to try to screen and have early detection. For we know that prevention is really better than cure. So the aim of screening is to prevent the development of the cancer by finding and removing it at the early stage. And this increases the likelihood of cure by early detection and treatment. So one of the major screening tools we have for breast cancer is a mammogram. You can see that it's an X-ray of the breast. They have a little thing to press on the breast and to take an X-ray. And we do know that screening mammogram actually reduces the breast cancer mortality by 25%. Who and how to screen is useful for those above 50, and some guidelines recommend 40 to be done every 2 years. All right, and yearly we start at 40. We do know that breast tissue in older women are not so dense, therefore mammograms are more accurate. Okay, so just a graphic show that if you go by routine mammogram, your average size of the lump is about 1.1 cm. If you feel it regularly after your period, the average size is about 2.1 cm. And of course, if you find it accidentally, it's usually about 3.6 cm. So you see that if you go for a mammogram, your tumor size is about 1/3 that found accidentally. Other methods of screening will include a breast ultrasound or a breast MRI. So this is useful for younger women when the breast is dense and the conventional mammogram is inconclusive. Okay, so the recommendation, as I mentioned in the mammogram, that one, age of 40 in some countries, age of 50 in others. In Singapore, we are using actually 40s. And I think in Indonesia it's the same. I'm not sure about the guideline in Indonesia, but also for women to realize that as long as after they deliver babies, they need to start checking on themselves already. So every time after the period, they check in the younger ones. But also for those with a very strong family history, they may need to screen a bit earlier. So those who have genetic problems or they have strong family history, usually will advise to start about 30 or 35, between 30, depending on how young is the youngest person in the family has breast cancer. For example, if your auntie has breast cancer at 40, you may want to consider screening, and the strong family history of breast cancer, you may want to screen at about 30 or 35. So they need to see a surgeon to have it operated to confirm that it's breast cancer, number one, and to do surgery to cure them. Of course, if it's very small, we usually will prefer to have surgery first. But if it's sizable, some surgeons may send to us to make it smaller so that it be easier, like what I mentioned, the neoadjuvant treatment. No, as I mentioned in my talk, surgery, alone, even for the very early stage, there's still a 5 to 20% chance of recurrence. So what we normally do, we'll do a biopsy and confirm the diagnosis of breast cancer. Depending on what type of breast cancer, the ER/PR, or is it a HER2, or is it a triple negative, we will follow up with adjuvant chemotherapy, hormonal therapy, and depending on what operation was given. So for example, we talk about the lumpectomy, they may need some radiotherapy. If they have a total mastectomy, then they don't need the radiotherapy.
Nah, salah satunya tadi adalah disebut kemoterapi. Ini yang paling, kalau di Indonesia sendiri, sepertinya paling banyak dan juga paling sering dilakukan kemoterapi, yang nantinya akan menyebabkan berbagai macam gejala yang lain, kerontokan rambut, kemudian kulit-kulit sakit dan lain sebagainya. Nah, ini apakah kemoterapi dan kerontokan rambut ini menjadi salah satu hal yang erat kaitannya, atau sudah dipastikan nih, Dok, kalau kemoterapi pasti ada rontok rambut?
You mean the hair loss? Yes, because the most effective chemotherapy drugs for breast cancer unfortunately causes the hair to drop. But actually nowadays we have this machine that seems to help some of our female patients to, it's like putting ice over the head and then to freeze the scalp before chemotherapy. And some of them, they do not have their hair loss at all.
Okay. Nah, dokter, sebenarnya untuk efek samping pengobatan ataupun kemoterapi kepada pasien ini, selain yang tampak nyata adalah kerontokan rambut, apa saja sih efek samping pengobatan kemoterapi ini?
Okay, it depends on what medicine we give. So it can vary from various, but most commonly we see people with mouth ulcers, they get nausea, they get vomiting, they feel weak. All right, so these are some of the more common, and then they are also peculiar to the drugs that we use. Some people, it may affect the heart function, and some people, it may have effect on the hands and feet, the numbness. But this usually for younger women, they tend to tolerate it much better than the older women.
Okay. Kalau ada efek sampingnya, apa yang bisa dilakukan oleh si pasien nih untuk mengatasi efek sampingnya, dokter?
Over the years, we've been having a lot of medicine, especially for nausea and vomiting. So most of our patients don't have a lot of nausea and vomiting. So and also we are having drugs that does not have so much side effects, the newer drugs that we are using. So, but whatever it is, there will still be some side effects, like they feel tired, they feel a bit weak initially, but those they get over after a while.
Nah, pengobatan-pengobatan yang seperti apa? Yang jelas di sesi yang berikutnya, Dr. Fu, nanti kita akan berbincang terkait dengan pengobatan tradisional Tiongkok dan kanker. Untuk Sobat Espos, kami akan segera kembali.
Con à, con nhớ đem theo hết tất cả các kết quả xét nghiệm đi theo con nhé.
The result of your mammogram shows there's an abnormal growth in the left breast. It's best that you seek treatment as soon as possible.
So, what options do I have?
At Parkway Cancer Centre, we place our patients' interests at the heart of all that we do.
No problem. I'll find you a specialist doctor to see and make an appointment as soon as possible.
We know every minute counts when a loved one is diagnosed with cancer and waiting a treatment plan. We value the essence of time as much as you do. As such, our multidisciplinary team of doctors, nurses, counselors, and other paramedical professionals will be activated immediately.
It's not easy to deal with a cancer diagnosis, so we'll be with you every step of the way. From the moment of diagnosis, we are ready to fight the battle with you.
All our doctors and medical professionals understand the fierce anxieties patients have to go through when faced with a cancer diagnosis. We are well adapted to handle these urgent situations. Our team members are friendly, reassuring, at the same time highly experienced and efficient to handle your care.
We will need to send you for further tests.
As a team, we strive to provide the best care you deserve.
Our doctors, laboratory and radiology diagnostic services work cohesively to give you peace of mind.
At Parkway Cancer Centre, we are capable of a swift response to match the urgency of the case.
Our seamlessly coordinated services are delivered under one roof. The battle against cancer is never an easy one, but through it all, we are here to support and guide you, ensuring you feel safe and assured, because we want you to focus your time on what matters most.
We are able to establish a histologic diagnosis, to stage to determine the extent of the cancer, and to come up with a treatment plan within 48 hours of seeing the patient. Good news, we have a treatment plan for you.
We will be by your side every step of the way.
Okay, so I will start by asking, what is TCM? What is traditional Chinese medicine? Okay, so TCM, or traditional Chinese medicine, is an ancient system of health and wellness used in China for thousands of years to prevent, diagnose, and treat diseases. TCM will include acupuncture, diet therapy, herbal therapy, meditation, exercise, moxibuction, and massage, or Chinese call it Tuina. So we talk about traditional Chinese medicine and cancer. First question is, does TCM actually work in cancer? Okay, I will tell you 3 stories and then I'll leave it for you to decide. Okay, so first story is a female in her early 40s with very advanced, this is Stadium Empat from Malaysia who saw me. She was on chemotherapy. One day she suddenly told me she doesn't want chemotherapy because she was told that a certain herb called porcupine bezoar, or the Chinese word is called He Zhu Zhao, will cure her. And she was told by her friends in her city. Unfortunately, she died quite shortly after taking this herbal combination. Okay, I will tell you the second story. Madam X, who is also on chemotherapy for breast cancer. This is adjuvant chemotherapy. And the doctor finds out her blood count is always low, her leukocyte, or the white cell count. And also there was inflammation of her liver when we do the blood test. And she confesses to taking some herbs which her friends recommended. And one of the herbs that is very common that cause this kind of problem is this drug called Lingzhi. And on stopping the herbs, the abnormal blood test actually became normal. However, the chemotherapy cycles were delayed because of this problem. And for us giving chemo, we do not like to have interruption, because every time there's interruption, it does affect the prognosis of the patient. Okay, so the third, as a result of these 2 stories, most oncologists here in Singapore are very afraid to allow their patients to go on TCM, especially with the risk of low white cell count, liver and kidney function impairment. Okay, so I will tell you the third story. This story is a Madam Ko, all right? She was 73 when she saw me about 15 years ago. She has a background of many medical problems. She has got a very bad heart. She got previous cervix cancer. And in 2006, she was found to have a liver cancer. In view of her very poor health and many medical problems, she didn't want any chemotherapy, and she went to take just pure traditional Chinese medicine. I didn't have any objections, and I just gave her a very long follow-up, thinking that, next time I see her, she probably will not make it. Okay, so I'll just show you some of the scans. This was done in May 2006. This was a scan done in July 2007. This is the liver, and this big mass here is actually the tumor, the liver cancer, smaller ones here and here. So she's got what we call a multifocal liver cancer in 2006. And to my surprise, in July 2007, 1 year and 2 months later, all the tumors disappeared. So it's the same in another cut of the liver. All these white dots here you see are the tumor, the tumbuhan. And over here, everything seems to have cleared except for one small little area here. Okay, so as a result of this patient, I got interested in Chinese medicine, and actually I did a course in acupuncture to learn a little bit more of Chinese medicine. Okay, so what is the basis for Chinese medicine? How different is it from Western medicine? It's very different. Okay, so as I mentioned earlier, this TCM is based on theories and practices for more than 2,000 years. There are a few principles which is very foreign to any Western trained doctors, but I have to go through all this so that you will understand later why I'm explaining certain things. So the first principle is the principle of yin and yang. When a person's yin and yang are balanced, he's in good health. Disease will occur when there's an imbalance of yin and yang in one's life. Okay, the second theory is that of vital substances. The vital substances in our body include the qi, or the vital energy, blood, number 3, essence, or the ting, and body fluids. Okay, so qi is a vital energy that is floating in our body. It goes up, it goes down, it's expelled, it's absorbed. It's responsible for moving blood. And we do know that in Chinese medicine is that the illness occur when the qi is out of balance. For example, there's a blockage. Okay. Blood is like what we do know is blood that is flowing in our body is the most dense among all the vital substances, and it flows through the blood vessels. And together with the various body fluids, it provides nutrition and moisture to our organs. Okay, ting or essence is the material basis of life. All right, this is the fluid like in the sperms. It influences our constitution, reproduction, the growth, development, and longevity. It's the foundation for the production of qi and marrow. Okay, body fluids, like what we know in Western medicine, is fluids from various organs and body secretions, and keeps the organs moist and transformed into blood. Okay. The next theory that we need to know is the 5 main organs of the zang in the body, namely the heart, the lung, the liver, the spleen, and the kidneys. These are considered yin in nature. And then there are 6 hollow organs of the food, namely the small intestine, large intestine, gallbladder, stomach, bladder, and organ called the triple energizer. And these are considered yang in nature.
Oke, Dr. Fu,
Yes.
ini luar biasa sekali TCM ini. Tapi bagaimanakah para ahli TCM bisa mengetahui apa yang menjadi penyakit seseorang? Bagaimana caranya TCM ini mendiagnosa seorang pasien untuk menentukan penyakitnya? Untuk kasus misalnya kanker payudara misalnya, bagaimana seorang ahli TCM ini menentukan penyakit dari si pasien ini?
Okay, actually I was coming to that, but just that there's still one more section which I need to finish before I answer that question. Okay, all right, so this is just a picture of the Wu Zhang Liu Fu, the 5 organs and the 6 hollow organs. All right, so the view of the Chinese medicine of the various organs are very different from what we know in Western medicine. So therefore, there's a lot of confusion. For example, when the Chinese physicians say your kidneys are not functioning, but when you see a Western doctor who does a blood test, the kidney function is normal because it's a totally different philosophy. Okay, so I will quickly go through the 5 major organs first. Then I will talk about the meridians, And then I will explain how does a person get illness in Chinese medicine, and then go back to talk about breast cancer in Chinese medicine. Is that all right? Yeah. So quickly, we talk about the liver. A liver is like what we do know in Western medicine, is the one that does the detoxification of our medicine. It stores sugar. It is helps to secretes bile to digest the food. And in Chinese medicine, the liver is totally different. Chinese people say that the liver is actually stores the blood. It regulates the blood volume. It regulates the flow of qi and affects the emotion. It stores the soul of the person. Any deficiency in the yin and blood of the liver or excessive yang will cause irritability, and anger will affect and hurt the liver. Okay, that's the liver. The next organ is the spleen. The spleen is this organ in this part of the body. Again, it's very different from what the Western doctors know. Western doctors know that the spleen is the organ that regulates our red blood cells, our platelets. All right, but in Chinese medicine, the spleen is very important. It governs transformation and transportation of our food and fluids in our body. It controls the blood. It controls all your muscles and all your four limbs. Okay, so the dysfunction or deficiency of the spleen is very common in this day and age, and it leads to poor appetite, abdominal distension, fatigue, weakness of the limbs. You look a bit sallow, your stools are loose, your legs and hands are always cold. Sometimes if it's bad, you get swelling of the legs. So the most common cause in this day and age of the spleen not working is excessive thinking or stress. Also cold food, also sometimes dampness in the environment. Okay, so quickly about the other organs. The heart, in addition to what we know in Western medicine of pumping medicine, in Chinese medicine is also the control our mind, our thinking process. The lungs, in addition to exchange of gases in respiration, also controls the descent and dispersion of qi and regulate the water passage in the blood and the body. Okay. The last organ that we know is, of course, the kidneys. So in addition to the water control that we know in Western medicine, in Chinese medicine, the kidneys control the storing of the essence, the reproductive functions, bone marrow, and hair functions, as well as the memory. Okay, so one thing that's interesting, which I want to mention, is that this problem of kidneys controlling the bone marrow is only up to 50 years ago that Western medicine found that the kidneys secrete a hormone called erythropoietin, which stimulates our red blood cells to grow, and to produce red blood cells. So in fact, the Chinese already knew about this 2000 years ago. Okay, so I'll quickly move on to talk about meridians. As I said, all these are related. Then we can talk about the pathology in breast cancer. Okay, so meridians are channels which transport the qi and the blood and connects the various organs, the limbs, the joints, from the inside to the outside. There are many regular meridians, and acupuncture points are points on these meridians that on stimulation can actually use to treat certain diseases. Okay, so this is a kidney meridian. It starts from the leg and goes all the way up to the chest. All right, and those who do the leg massage, foot massage, they like to stimulate this point called the Yongquan to stimulate your kidney meridian to help you in your kidney function. Okay. So we come to the TCM view of what causes illness. All right, so in Chinese medicine, there are a few endogenous factors and some exogenous factors that can cause illness. So the common endogenous or psychological factors, they call it the 7 emotions, namely excessive joy, anger, anxiety, melancholy, sorrow, fear, or fright. Exogenous factors, they call it the 6 evils, namely wind, the cold, summer heat, dampness, dryness, and fire. These are usually related to climate changes. The third causes of illnesses are not endogenous or exogenous factors. For example, eating unhygienic food, overindulgence of heaty food or cold food, or over-exhaustion or over-idleness can cause illness.
Berarti berbeda sekali memang ya dari pengobatan barat ya dok ya, penyebab sakitnya pun juga sangat berbeda gitu.
Exactly, it's very different.
Oke, silakan dokter.
Okay, so as I mentioned, emotions play a very important part in Chinese medicine, and they found that anger will affect your liver, excessive joy will affect your heart function, anxiety or stress will affect your spleen, sadness will affect your lung, and fear will affect your kidney. Okay, so how does a Chinese physician diagnose a patient? Okay, so most commonly they will ask, they will observe, they're supposed to auscultate and smell, but most of the time they don't. And last of all, they will take the pulse. Okay, so when a Chinese physician takes your pulse, his index finger is called the chun, the middle finger is called the guan, and the ring finger is called the chi. On the left side, the chun is actually the heart function, the guan is the liver, the chi is the kidney function. On the right side, the chun is the lung function, the guan is the spleen, and the chi is the kidney function. Mingmen is actually kidney function. Okay, so they also look at your tongue, and different types of tongue will tell a physician what is happening in your body, which organ is not working. Okay, so how do we diagnose in Chinese medicine? Usually they have different syndromes. Either is it yin and yang that's abnormal? Is there an interior or exterior problem? Is it a cold or heat problem? Or is it a deficiency or excess problem? Okay, so let's talk about cancer in Chinese medicine. Okay, so in Chinese medicine, they find that it's related to the qi being stagnant, and then the blood also being stasis, followed by the organ dysfunction, especially the liver and spleen and kidneys are not working. Then the flans are condensed, and there's accumulation of heat and dampness and blockage of the meridians. Okay, so let's zoom into breast cancer. So there are 6 major meridians affecting the breast. This includes the stomach meridian, the liver, the kidney, the lung, pericardium, and the spleen meridians. It is believed that keeping the energy flowing through all these meridians is important in the prevention of cancer. Okay. So according to the Emperor's Neijing, which is the Bible for Chinese medicine, breast tumors occurs when the 6 evils, which we mentioned earlier, the wind, the cold, the dampness, the dryness, summer heat, cause obstruction to the meridians, especially the liver meridian in breast cancer. Of course, there are other theories that it is due to exposure of wind and cold, stasis of blood, all right? But the most common is the blockage of the liver meridian. Okay, so we also do know in Chinese medicine that certain psychological factors may aggravate the tumor formation. And for breast cancer, it is related to anger. So about 1,000 years ago, already a Chinese physician says that, you know, this lady who gets breast cancer is because she's a lady who does not have a good relationship with her husband or family members. She gets chronic anger, she gets depressed, worry, and nervousness. And because if it's not treated, it will cause the spleen qi or the digestive system to be disordered and liver qi stagnation. And eventually there'll be a lump in the breast that causes no pain or itchiness. And many years later, this lump will change a different shape. And it's called a yan or cancer. All right. And then they say once this happens, it's very difficult to treat. This was written by a Chinese physician in 1821. Okay, so this is a summary. So it starts with all this anger, it affects your liver, your spleen, and then there's dampness, there's other inherited factors. The qi becomes stagnant with phlegm, with heat toxins, causes breast cancer. Of course, also some kidney deficiency of qi and blood will affect breast cancer. Okay. So another thing to note is that, you know, for example, you have a stage 2 intraductal breast cancer. everywhere in the world, people will know exactly what I mean when I say stage 2. Unfortunately, in Chinese medicine, there are 4 different possibilities, including a liver qi stagnation, phlegm heat obstruction, liver kidney deficiency, or deficiency in qi and blood. And all the 4, we have 4 different types of Chinese medicine's herbal treatment. Whereas a standard stage 2 breast cancer, the standard treatment is still the same, surgery followed by either chemo or hormonotherapy. So you have to bear in mind that the Chinese people see the cancer very differently from what you and I are exposed to in Western medicine.
Dr. Fu, jika
Yes.
di pengobatan barat seorang yang terdiagnosis kanker ini, kanker payudara ataupun kanker yang lainnya, biasanya mereka memerlukan beberapa kali observasi, kemudian pengobatan-pengobatan yang cukup panjang. Istilahnya step-stepnya cukup banyak gitu ya, berbagai macam tahapan. Nah, kalau untuk pengobatan melalui TCM ini seperti apa pengobatannya? Alurnya berapa banyak, berapa kali mereka harus menjalani pengobatan, menjalani terapi?
Okay, actually, I'm also coming to that to answer that question. You should just ask me ahead of my presentation. Okay, so is it okay if I just go ahead and then I will answer the question along the way? Okay, so first I asked myself, is there a role for Chinese medicine in cancer treatment? Before I ask that, according to the Chinese medicine, all this chemotherapy, surgery does affect your body. And so, what are the effects of chemotherapy and radiotherapy based on Chinese medicine? Basically, your stomach, your spleen, your kidney functions are affected. Your qi is affected. So, how to get better is to improve your organ function and also to improve your qi. So this is where the TCM comes in. So in essence, to answer her question, Chinese medicine is more like a complementary to the chemo, radiotherapy, and surgery, because all those affects your body. With Chinese medicine, it's just to harmonize it, to bring it back to normal. Okay, so how long will depends on how your body reacts to the herbs. All right, so you will need to go back and see the Chinese physician every few weeks, to check and see whether your spleen function, your stomach, kidney functions are better, whether your qi is better. So once it's all back to normal, you can stop the treatment. But for Chinese medicine to treat breast cancer, personally, I don't think it is useful, because breast cancer is very fast growing and Chinese medicine takes a long time to work, and I don't think it's fast enough to treat for breast cancer. Maybe I will pause here, see whether there are any questions first.
Untuk perawatan atau seperti yang dijelaskan Dr. Fu tadi, bahwa memang untuk TCM ini adalah pelengkap begitu ya. Nah, apa saja sih yang selain terapi-terapi apa saja yang bisa dilakukan ataupun yang biasanya diterapkan dalam TCM ini? Apakah misalnya akupunktur atau ada yoga kah atau yang lainnya? Karena kalau dari penjelasan Dr. Fu tadi, penyakit-penyakit ini kan bersumber pada berbagai macam elemen yang ada di alam dan juga ada happiness, anger, and so on gitu. Gimana dokter?
We'll be talking about treatment in Chinese medicine. So as I mentioned, there is not just herbs, there is acupuncture, there's this thing called moxibustion. There's also mesotherapy, which is a form of massage. Then there's diet therapy, there's psychotherapy. Then, Chinese like to do qigong. They like to do this. And then, of course, I think in Indonesia it's very common. They do scraping, bloodletting, as well as cupping. Okay. I will skip this. I will talk a little bit of the prescriptions in the herbal medicines. Basically, in any traditional Chinese medicine, herbal medicines, there are about 20 herbs. It will contain, number 1, the monarch or the principal herbs, which is the most important one. There's the adjuvant herbs that will strengthen the principal herbs. There are auxiliary herbs to reduce the unwanted side effects. And then there are conductant herbs, which will direct the action of the various herbs to the disease meridian or organs. Okay, so for breast cancer, there's no standard formula. It's actually very individualized. It depends on how the Chinese physician feels is the main problem of the day when you see the Chinese physician. And it's sometimes in the form of acupuncture, sometimes they give a very complex, as I mentioned, about 20 to 25 herbs, depending on what symptoms you have. Okay, so I will skip this one about all the different herbs for breast cancer. All right, and we just bear in mind that for any herbs, there's always side effects, especially in the liver and all these blood counts. So you need to tell your oncologist if you want to take Chinese medicine so that they can monitor. For those women who are hormone receptor positive, remember those ER, PR positive, there are some herbs that you cannot take. And these are the herbs that you cannot take, mainly the renshen or ginseng, angelica or tangui, tangshen is another herb, huaishan or the wild yam, epimedium or the yin yang huo, and some other herbs like DHEA as well as black cohosh. Okay, so besides herbs, what about acupuncture? Okay, so you can see the needles sticking out of this man's head. These are acupuncture needles. So acupuncture in cancer is usually mainly used for control of pain and also to reduce nausea and vomiting. Unfortunately, now we have very good medicine, injection and tablets. So I never have to use acupuncture. We used to use it like 25 years ago. Acupuncture also has been used to reduce the hot flushes in breast cancer patient. This is for women. Also for men with prostate cancer, it's also useful for these hot flushes. And recently there was a paper that also showed that acupuncture is useful for those with very dry mouth after radio and chemotherapy for cancers of the throat. Okay, so this is one in the hospice, but also in head and neck cancer, we find that it's useful, acupuncture. Okay, what are the other forms of therapy? Includes massage. This one is called moxibustion, where they put a little cupping. Sorry, this is a cupping where they put a bit of fire and they put the cup onto the skin. Then this is the cupping. This is moxibustion, where we put in a little like a candle like that, but it's actually herbal medicine over acupuncture point. Okay, so this has been used for many years. The herb we use is called aiye or mugwort. It's supposed to stimulate and warm the qi to combat against the cold and dampness. It warms the blood, it stops bleeding, it's good for maintenance of general health. There's a question, is it from her?
Ya, satu pertanyaan terakhir sebelum kita berpindah ke sesi yang berikutnya, dokter. Kapan sih seorang pasien yang terdiagnosa kanker ini harus mulai pengobatan dengan TCM? Atau kalau kapan nih si pasien harus berhenti? Ada nggak istilahnya batasan-batasannya, dok?
Okay, so in general, I will usually tell my patients if they are doing well with their chemotherapy, or they are doing well after their surgery, chemotherapy or radiotherapy, they don't really need a Chinese physician. Of course, if they have a lot of side effects, they feel tired, their blood count is always low, that is when you may need to see a Chinese physician to help to reduce the side effects. But in my case, because I do have a background of Chinese medicine, I will usually insist on knowing what are the herbs and all that, because some of the Chinese physicians will use herbs that actually has cancer property. And if I'm giving chemo and he uses a drug with a herb that has cancer property, patient will have more side effects. So like what I showed earlier, the white cell doesn't go down. I mean, it's go down but never come out. So these are certain situations where you need to know a little bit of the herbs to tell them not to use those herbs.
Dr. Fu, kami akan kembali lagi, kita akan ngobrol lagi, berbincang kembali tentunya di sesi berikutnya. Dan Sobat Espos Live, kami akan segera kembali bersama dengan keluarga dari penyintas kanker payudara. Tetaplah bersama kami dalam Espos Live.
Con à, con nhớ đem theo hết tất cả các kết quả xét nghiệm đi theo con nhé.
The result of your mammogram shows there's an abnormal growth in the left breast. It's best that you seek treatment as soon as possible.
So, what options do I have?
At Parkway Cancer Centre, we place our patients' interests at the heart of all that we do.
No problem. I'll find you a specialist doctor to see and make appointment as soon as possible.
We know every minute counts when a loved one is diagnosed with cancer and waiting a treatment plan. We value the essence of time as much as you do. As such, our multidisciplinary team of doctors, nurses, counselors, and other paramedical professionals will be activated immediately.
It's not easy to deal with a cancer diagnosis, so we'll be with you every step of the way. From the moment of diagnosis, we are ready to fight the battle with you.
All our doctors and medical professionals understand the fierce anxieties patients have to go through when faced with a cancer diagnosis. We are well adept to handle these urgent situations. Our team members are friendly, reassuring, at the same time highly experienced and efficient to handle your care.
We will need to send you for further tests.
As a team, we strive to provide the best care you deserve.
Our doctors, laboratory and radiology diagnostic services work cohesively to give you peace of mind.
At Parkway Cancer Centre, we are capable of a swift response to match the urgency of the case.
Our seamlessly coordinated services are delivered under one roof. The battle against cancer is never an easy one, but through it all, we are here to support and guide you, ensuring you feel safe and assured, because we want you to focus your time on what matters most.
We are able to establish a histologic diagnosis, to stage to determine the extent of the cancer, and to come up with a treatment plan within 48 hours of seeing the patient.
Good news, we have a treatment plan for you.
We will be by your side every step of the way.
Sobat Espos, di Espos Live kali ini tentunya masih bersama dengan PCC Parkway Cancer Centre Singapura, dan kita masuk ke sesi yang ketiga. Dr. Fu sudah menjelaskan sedemikian banyak seperti apa kanker payudara dan juga pengobatan dari TCM. Nah, sekarang saya sudah bersama dengan keluarga dari penyintas kanker payudara. Ada Mas Ferdinand Kusumo. Selamat pagi, siang, sore Mas.
Selamat pagi, siang, sore Mbak Nur.
Oke, di kesempatan kali ini kita akan ngobrol terkait dengan keluarga penyintas. Nah, ini kalau boleh diceritakan untuk penyintas ataupun keluarganya ini apa sih yang harus dilakukan dan responnya pada saat itu seperti apa?
Oke, jadi ketika tahu bahwa memang keluarga ini kebetulan tante, tapi cukup dekat dengan saya, itu ketika ketahuan bahwa beliau itu terkena kanker payudara, itu mungkin langkah pertama memang kita support secara psikologis, Mbak, ke tante. Walaupun memang kondisinya karena waktu kena, seperti yang dokter jelaskan tadi, di usia yang cukup sudah agak lumayan ya, di atas 50. Untuk kena pertama, dan mungkin masih ada beberapa pengetahuan yang kurang, jadi agak malu, Mbak. Jadi itu yang kita support untuk biar tidak malu dan mau untuk terus berobat. Gitu. Karena memang beratnya adalah ketika rasa malu itu muncul dan ada denial ya dalam diri bahwa kok saya bisa kena ya gitu. Karena memang literasi atau pengetahuan terkait kanker payudara masih sangat minim waktu itu. Sehingga ya memang itu yang terberatnya adalah memberi support untuk tetap mau pengobatan.
Oke. Pendampingan kepada orang yang denial terhadap penyakit yang dia derita di hidupnya, atau istilahnya apa ya? pada saat itu mengalami drop nggak sih Mas, istilahnya secara mental ya, tertutup, jadi lebih tertutup kah, atau menjadi lebih sensitif kah, atau seperti apa, dan apa yang dilakukan keluarga?
Ya, memang ketika dapat ketahuan pertama, yang pasti drop pasti Mbak. Drop, tertutup, justru awal-awal itu tidak mau ketemu saudara. Jadi memang seperti apa ya, denial bahwa saya tidak merasa, saya baik-baik saja, saya sehat-sehat saja, tapi kok saya kena. Gitu. Jadi berat. Untuk pertama memang untuk dideketin, untuk dikunjungin saudara aja tidak mau. Saya yang mungkin, saya tidak tinggal satu rumah, tapi posisinya saya hampir setiap hari datang ke rumah beliau sebelumnya. Ketika beliau kena itu, saya mau ke rumahnya aja tidak diizinkan. Butuh waktu proses untuk beberapa saat, sampai beliau mengizinkan kami datang ke rumah. Beliau tinggal sendirian waktu itu.
Pada saat ketahuan, ini sudah sampai stadium berapa?
Stadiumnya sudah, kalau nggak salah stadium 3, sudah memang stadiumnya sudah cukup akut.
Berat ya?
Iya, sudah cukup berat. Jadi memang dari sisi ketahuannya juga sudah terlambat. Baik lagi karena memang nggak dirasa. Beliau tipenya adalah ketika sakit ya udahlah, ya udah. Kalau orang Jawa bilang ya wis gitu kan. Jadi akhirnya ketika memang keluhan itu semakin kentara, dipaksa sama saudara untuk kita paksa bareng-bareng untuk periksa, dan ternyata memang benar beliau mengidap kanker payudara, dan setelah berapa kali pemeriksaan lab terbukti bahwa stadiumnya sudah cukup mengkhawatirkan ya. Saya dilihat dokter stadium 3 kalau nggak salah.
Nah, mungkin bagi sebagian penyintas kanker payudara ataupun penyintas kanker yang lain merasa bahwa itu tadi denial, kemudian jangan dikasihani dan lain sebagainya. Ya. Jadi kadang-kadang kita untuk mengungkapkan bahwa kita peduli itu agak berbeda dari biasanya, dan itu kadang-kadang mengganggu bagi si penyintas gitu ya.
Betul sekali.
Nah, ini kalau dari tantenya Mas Ferdinand ini seperti apa waktu itu untuk biar si penyintas ini tidak merasa bahwa dikasihani atau tidak merasa dibedakan gitu?
Untuk awal-awal tetap kita kasih perhatian yang lebih ya dengan beliaunya, tetapi ketika memang sudah berjalan sekitar 1-2 bulan setelah beliau sudah bisa menerima, kita tetap membiarkan beliau beraktivitas seperti biasa, masih berkumpul dengan teman-temannya, masih bisa berkumpul dengan yang di luar lingkungan seperti itu. Berharapnya dengan banyak berkumpul itu bisa menghibur atau menaikkan secara psikologisnya beliau, jadi lebih kuat lah beliaunya. Jadi seakan-akan tidak ada perubahan lah dalam diri dia, bahwa dia masih oke-oke aja. Gitu.
Karena kanker payudara ini kan tidak terlihat secara umum kasat mata bagi orang lain, yang bisa merasakan dan juga melihat cuma orang-orang terdekat saja. Nah, ini apakah juga kemudian tantenya dari Mas Ferdinand ini apakah juga publish bahwa oke, saya terkena kanker payudara, it's okay, ayo kita beraktivitas, atau seperti apa?
Oh tidak Mbak, jadi
masih tetap tertutup.
Tertutup, hanya keluarga dekat yang tahu. Jadi beliau tidak bilang bahwa beliau sakit apa.
Tidak berkenan ya untuk dipublikasikan.
Sampai dengan akhir hayatnya pun tidak banyak yang tahu, hanya saudara-saudara dekat yang tahu.
Kemudian selama berapa tahun dari proses ketahuan sampai akhirnya tidak ada?
Cepat Mbak, karena beliau itu takut untuk berobat. Jadi memang beliau pengobatannya hanya berdasarkan herbal, tapi kita ngomong herbalnya ada herbal by orang biasa yang misalkan udah minum ini aja seperti itu, dan dikontrol di rumah sakit pun juga nggak rutin karena balik lagi beliau merasa fine aja. Dropnya itu sampai tidak bisa apa-apa itu sekitar 3 bulan. 3 bulan itu benar-benar drop, sudah nggak bisa diapa-apain juga. Akhirnya ya, beliau tidak ada.
Kemudian dari istilahnya proses dari ketahuan sampai dengan tidak ada, kemudian dilakukan oleh keluarga ini pendampingan, kemudian pendekatan yang lebih dari sebelumnya. Nah, ini pelajaran apa yang bisa diambil dari Mas Ferdinand dan juga keluarga?
Kalau dari saya mungkin lebih ke arah kita banyak tahu, belajar juga memberi penjelasan bahwa kanker itu bukan penyakit yang menakutkan ataupun penyakit
Bukan aib
yang
juga ya.
aib ya, memalukan, bukan memalukan. Kalau menakutkan mungkin untuk beberapa, kalau udah stadium tinggi mungkin ya, cuma bukan sebuah aib ya Mbak. Jadi orang kena kanker itu bukan sebuah hal yang memalukan. Jadi kita lebih baik banyak sharing dengan orang-orang yang tahu, lebih banyak mencari info tentang baik itu pengobatan medis maupun yang non medis, dalam artian herbal ya gitu. Tapi juga harus hati-hati juga ketika mencari informasi. Jangan sampai ketika pengobatan itu juga kita salah langkah. Tadi penjelasan dari Dokter Fu tadi cukup membuka juga hal yang seperti ini yang mungkin harus banyak dilakukan oleh keluarga-keluarga yang memang mungkin ada orang terdekatnya yang terkena kanker.
Oke. Nah, kalau dari penjelasan Dokter Fu tadi, TCM udah pernah dengar nggak sih, Mas?
Sejauh ini belum, tapi kalau pengobatan herbalnya atau Chinese medis sudah pernah, sering kan gitu. Tapi kalau untuk spesifik TCM sendiri saya belum pernah mendengar sebelumnya.
Oke. Kemudian kalau kita dia bisa berandai-andai, tapi kalau dari penjelasan Dokter Fu tadi, apakah relate juga dari pengobatan dari Tante Mas Ferdinand? Istilahnya kan Dokter Fu tadi menyampaikan ada beberapa resep gitu ya, resep medical Cina gitu ya, Chinese gitu. Nah ini apakah juga dilakukan juga? Karena Mas Ferdinand juga bilang bahwa tantenya juga cuma herbal-herbal saja gitu.
Iya. Kalau dibilang spesifik medical Cina ataupun herbal yang resep Cina itu, kita nggak tahu Mbak, saya jujurnya nggak tahu. Waktu itu obatnya sudah diberikan dari saudara. Saudara ini obat yang katanya bisa menyembuhkan, bisa mengurangi. Nah ya seperti itu. Jadi penjelasan dokter tadi misalkan harus ada ingredient yang jelas oleh pakarnya. Nah itu yang kita nggak tahu. Itu yang berbahaya. Memang kesalahan di kami adalah ketika memang ada beberapa orang untuk memberi suggest bahwa ini bagus, tapi kan bagus untuk orang lain, belum tentu bagus buat kita. Seperti itu. Jadi mungkin bukan keliru ya, mungkin ketidaktahuan kita adalah kita tidak tahu harus berkonsultasi dengan siapa, harus kita ngomong dengan siapa untuk bisa tahu jalan yang benar. Gitu, Pak.
Oke, nah kan ada keluarga yang terkena kanker payudara. Nah ini apakah kemudian menjadi kewaspadaan bagi keluarga besar juga nih? Harus screening lah atau harus melakukan pengobatan deteksi dini untuk keluarga sendiri?
Sejauh ini belum, tidak ada Mbak. Ya kita cuma berharap tidak
ada lagi ya.
Ada lagi ya, karena kebetulan kalau dari beliau tante saya kebetulan tidak menikah, tidak menikah, kemudian tidak punya anak. Memang banyak saudara perempuannya, tapi kebetulan juga sejauh ini hanya beliau yang terkena kanker payudara.
Oke. Karena memang tadi penjelasannya lifestyle, kemudian tidak menikah, kemudian tidak menyusui dan lain sebagainya juga menjadi salah satu.
Iya, saya baru tahu tadi.
Ya.
Iya, itu baru mungkin salah satu penyebab, salah satu faktor yang menjadi besar seperti itu juga ya.
Oke. Baik, tapi yang kalau sekarang keluarga semuanya sehat, kemudian semuanya juga sudah terbebas dari sakit dan juga semoga bebas dari kanker juga.
Amin Mbak, terima kasih.
Oke, terima kasih Mas Ferdinand.
Sama-sama Mbak Nur.
Ya, Sobat Expose Live, demikian sedikit berbincang bersama dengan keluarga dari penyintas kanker payudara Ferdinand Kusumo. Semoga saja menjadi pelajaran kita semua. Kita harus aware, kita harus bisa memberikan perhatian yang lebih kepada para penyintas kanker payudara. Kita ke sesi berikutnya, ada tanya jawab bersama dengan Dr. Fu. Tetaplah bersama kami di Expose Live.
Con à, con nhớ đem theo hết tất cả các kết quả xét nghiệm đi theo con nhé.
The result of your mammogram shows there's an abnormal growth in the left breast. It's best that you seek treatment as soon as possible.
So, what options do I have?
At Parkway Cancer Centre, we place our patients' interests at the heart of all that we do.
No problem. I'll find you a specialist doctor to see and make appointment as soon as possible.
We know every minute counts when a loved one is diagnosed with cancer and waiting a treatment plan. We value the essence of time as much as you do. As such, our multidisciplinary team of doctors, nurses, counselors, and other paramedical professionals will be activated immediately.
It's not easy to deal with a cancer diagnosis, so we'll be with you every step of the way. From the moment of diagnosis, we are ready to fight the battle with you.
All our doctors and medical professionals understand the fierce anxieties patients have to go through when faced with a cancer diagnosis. We are well adept to handle these urgent situations. Our team members are friendly, reassuring, at the same time highly experienced and efficient to handle your care.
We will need to send you for further tests.
As a team, we strive to provide the best care you deserve.
Our doctors, laboratory and radiology diagnostic services work cohesively to give you peace of mind.
At Parkway Cancer Centre, we are capable of a swift response to match the urgency of the case.
Our seamlessly coordinated services are delivered under one roof. The battle against cancer is never an easy one, but through it all, we are here to support and guide you, ensuring you feel safe and assured, because we want you to focus your time on what matters most.
We are able to establish a histologic diagnosis, to stage to determine the extent of the cancer, and to come up with a treatment plan within 48 hours of seeing the patient.
Good news, we have a treatment plan for you.
We will be by your side every step of the way.
Baik Sobat Espos, di Espos Live tentunya masih bersama dengan PCC Parkway Cancer Centre Singapura dan masih bersama dengan Dr. Fu. Dan sekarang kita masuk ke sesi tanya jawab. Sudah ada beberapa pertanyaan dan sudah kami pilih satu. Di sini ada netizen yang bertanya dari Anissa Nurul Aini, apakah bahan dasar pengobatan tradisional Cina? Apakah bahan-bahannya mudah didapatkan di Indonesia? Silakan dokter.
Yes, definitely. I think you have to go to the Chinese medicine shops in Indonesia. I think all over Indonesia there are Chinese medicine shops which they can go and buy. Okay, actually it's the next next slot, but I don't have time to talk about it today. I think it's too boring for some people. I actually mentioned it just now about 20 to 25 herbs, and for depending on which herb, and then depending on what is the use for what herbs. There are many different herbs for different users. So there's no one herb that's a magic formula. It depends on which organ is affected, which meridian is affected. We use different herbs.
Oke, berarti bisa dibilang obat yang diberikan ini sangat personal ya dok ya, tergantung dari kondisi tubuh masing-masing pasien, begitu?
Yes, that's correct.
Oke, biasanya berapa lama seseorang ini bisa mengkonsumsi ataupun harus mengkonsumsi dokter? Apakah harus sehari 3 kali atau seperti pengobatan barat begitu?
Yes, so it depends, as I mentioned earlier, it depends on the condition and also whether the underlying problem has been solved. Remember I was saying if there's organ dysfunction or the qi is not enough, whether the herbs work fast enough. So some people may take a longer time, some people a shorter time. So an average is about maybe a week up to a few months, depending on how the person's general health is before they saw the Chinese physician.
Dokter, apakah dalam pemakaian jangka waktu lama pengobatan dengan obat-obat herbal TCM ini tidak menimbulkan efek samping, dokter?
Certainly, I think there is. Just that we have not done enough studies, because every time in Singapore when we have patients who silently they go and take herbs, we find their liver going haywire, liver function, or the kidney function going haywire. And the minute we tell them to stop the herbs, we find that it goes back to normal. But certainly some of these herbs, do have side effects. So you have to be careful, and you have to make sure you see a qualified Chinese physician.
Dokter, satu pertanyaan terakhir. Seandainya kita sedang menjalani pengobatan dengan TCM, misalnya tadi dokter sampaikan ada ketika dalam pemakaian waktu lama, ini ada di organ hati ataupun organ-organ yang lain ini terlihat gitu. Apakah ada hal yang bisa dilakukan si pasien, misalnya ketika sedang berada di pengobatan TCM, kita perbanyak minum air putih atau mungkin mengkonsumsi makanan-makanan yang lain begitu?
Usually, if there's causing side effects, we will advise to change or stop the herbal medicines.
Ada tanda-tanda khususnya nggak?
It depends on the side effects. Sometimes yes, sometimes no. So, for example, you have diarrhea, is very obvious, right? You have vomiting, is very obvious. But sometimes it is a long-term side effects, and so that's why you need to see a regular, because it's a problem here in Singapore, and I know in Indonesia, your friend will say this herbal or this medicine is very useful. It's in a bottle form, and then actually it is adulterated with steroids, and then you end up with more side effects, and actually it's not a truly Chinese medicine because they add steroids and other things inside, like slimming pills and other things inside the herbal medicine, so to speak. So sometimes you may not have, unless the effect is very bad, then there are cases who died from all this adulterated herbal medicine.
Oke, terima kasih sekali Dr. Fu untuk penjelasannya. Sukses terus untuk Anda.
Okay, thank you so much. I will stop share.
Sobat Espos Live, di kesempatan kali ini sampai juga kita berada di ujung acara, dan tentunya sudah banyak sekali penjelasan-penjelasan dari Dr. Fu, kemudian sharing pengalaman dari Mas Ferdinand Kusumo, dan juga pertanyaan-pertanyaan dari netizen yang sudah kami terima. Semoga saja bisa memberikan pelajaran, memberikan informasi tambahan bagi Sobat Espos semuanya, dan juga bermanfaat untuk kita semuanya. Saya Nur Atmaja, undur diri dari kanal Anda, dan tentunya tetaplah bersama dengan Espos Live dalam talk show virtual lainnya.